Good evening, everyone. Before commencing, I would like to thank the Haryana Ophthalmological Society and the All India Ophthalmological Society for this opportunity. My topic is clinical epidemiological profile of patients presenting with traumatic corneal laceration at a tertiary healthcare center of North India. Injury to cornea can result from trauma, typically from a metallic, plastic, or other object impacting and breaching the corneal layers. Clinical features include acute, severely painful eye with lacrimation, photophobia, and impaired vision. Corneal laceration can lead to the development of ulcer, followed by an opacity, which is a significant cause of ocular morbidity. Aim was to assess the epidemiological factors like age, mode of injury, causes, clinical features, management, and outcomes in patients presenting with traumatic corneal laceration to a tertiary care institute of Haryana. Objectives included to find out if there is any association between mode of injury with the final visual outcome and to assess if there is any association between the presenting visual acuity and the final visual outcome. A retrospective case study was done after taking permission from Institute's Ethic Committee in patients presenting with traumatic corneal laceration to Trauma Center and Ophthalmology OPD at PGIMS Rohtak and underwent emergency surgery. Medical records of these patients between April 22 to 23 were taken into account and reviewed. Inclusion criteria was patients with complete records who presented within 24 hours of trauma, and patients with a follow-up of less than 6 weeks were excluded. The following details were taken into account: personal details and demographic details, detailed history including chief complaints, history of presenting illness, past history including the use of spectacles, trauma, surgery, etc. Ocular examination included unaided visual acuity and best corrected visual acuity with age-appropriate refraction, ocular adnexa including eyebrow, eyelids and eyelashes, anterior segment examination including cornea, conjunctiva and pupillary reaction, fundus examination was done. Corneal laceration repair was carried out with 10-0 nylon sutures under GA for children and under LA for adults within 24 hours of presentation. Post-operative findings were noted at 1 week and 6 weeks, which included visual acuity, status of sutures and any other complications. Results revealed that data of total 30 patients was taken into account, out of which 60% were males and 40% were females with age ranging from 2 to 47 years and a mean age of 15.28 years. 60% of the patients were aged less than 10 years, as can be seen in the bar graph. This is the pie chart demonstrating percentage distribution of different modes of injury. It should be noted that wooden stick is the most common mode, followed by roadside accident. This is a table demonstrating visual acuity at presentation and at follow-up of 6 weeks. It should be noted that patients who presented with a better visual acuity demonstrated final better visual outcomes. After 6 weeks of follow-up, visual acuity of up till 660 were achieved in 30% patients. There was a statistically significant correlation between the presenting visual acuity and a final visual outcome with a p-value of 0.002. However, no statistically significant correlation exists between age, sex, and mode of injury with the final visual outcome. 16.67% patients developed endophthalmitis and underwent conservative treatment. Our study revealed that corneal laceration is more seen in children. This is consistent with findings of Bairaju AM et al. In Nigeria. Malika et al. And Grishbar et al. Conducted similar studies in 2009 and 2006 and found out that most corneal laceration occur as a result of wooden stick injury and roadside accidents. This is consistent to findings in our study. However, our study differs from the above that all patients presented within 24 hours of injury and were repaired within 24 hours due to round-the-clock emergency OT services and a great anesthesia backup. Owing to this, our patients achieved better visual outcomes. The limitations of our study was a small sample size, retrospective nature, and a short follow-up. To conclude, traumatic corneal laceration is a significant cause of uniocular morbidity and visual impairment. Urgent diagnosis and timely management can prevent disastrous sequelae like corneal blindness and endophthalmitis. Formation of an urgent referral trauma team and strict legislative guidelines, along with public eye health education, can optimize the visual outcomes. These are my references. Thank you.
Thanks a lot. Wonderful study.
The lacerations you mentioned, were they partial thickness, the oblique, the
They were all, ma'am, full thickness.
Full thickness. Yes, and were they associated with iris prolapse associated?
Yes, ma'am. It was, although it was associated, but we have not included that in our study.
Nice study which you have done. But your rate of endophthalmitis is pretty high, 16-17%.
Yes, sir. Actually, some of the patients, they were from a very poor background. They were not compliant with the medications despite counseling them properly. Most of these patients were belonging to the rural background. We tried to help them out, but
It's not that. Basically, did you do B scan at the time of the presentation? And
No.
because it was done in emergency hours, I think thorough investigation should be done in all these cases. And if there is an involvement of posterior segment at the very first instance, then you have to give intravitreal vancomycin and maybe voriconazole, looking to the type of. So that is what is the dictum to be followed, and that will decrease the endophthalmitis incidence. So first thing, or early detection of endophthalmitis, which will decrease the load of bacteria and fungus in the.
How much was your follow-up in this? How frequently you have called them for follow-up?
sir, on post-operative day 1, day 7 and 6 weeks.
So you could not pick up on the day 7.
Sir, in between also we had called for follow-up of 2 weeks also, but not all patients came. But most of them came at 1 week and 6 weeks. That's why I have included that data.
Thanks.
Thank you, sir.